And then we're going to open it up for you to ask us what you want to know and what we can answer. We want to quickly overview what Family Caregivers of BC provides. We're a provincial program. We're a nonprofit charity that's dedicated to the well-being of family caregivers since 1989. And since 2010, we have been servicing caregivers across the province with support from the Ministry of Health since 2014. We have 3 program pillars. The first one is caregiver support. This might be one of the ones that you're most familiar with. We have a BC caregiver support line where caregiver support line staff and caregiver coaches engage and support family caregivers to help them find information, referral and navigation, emotional support. We have some one-to-one caregiver coaching for caregivers that require some additional support. We have our caregiver support groups, and we also offer support group facilitator training. We have an amazing caregiver learning center, and it's all about education. So we've got great downloadables, we've got flip books, we have webinars, we've got podcasts, we've got self-paced courses. It's a wonderful place to refer family caregivers to check out, but also as healthcare providers to have the opportunity to peruse some of the information that might be really helpful and handy interfacing with family caregivers. We have a fantastic newsletter that comes out quarterly, and we have e-news and articles and blogs. And finally, the third pillar is our engagement and collaboration. And this is where our Caregiver RX program spends most of its time. And it's really with the health and social sectors. And we look at ways that we can engage in health sector planning and service delivery, and how we can work with healthcare providers to ensure that family caregivers are seen and heard. So why should family caregivers be included as partners in care? We adjusted this slide from a recent presentation from the Alberta Association of Caregivers. We just thought it was such a great visual. So as we can see, family caregivers are managing so many aspects of care, and they often know the care recipient better than the individual that they're currently seeing or the care team. And as we can see, caregivers end up doing 80% of care for the care recipient that they're caring for. We also find that generally individuals who have complex chronic conditions, that they move across a variety of care settings. And so they end up requiring a whole bunch of different types of supports from different areas of either the health or social sectors. And so often it's the family caregiver that's having to manage all of that coordination. They're doing a large chunk of that. And so information provided by the caregiver is really important and dependable as often a medical record. And it's often, because care management is often the primary responsibility of the caregiver, they often are the ones that have the most relevant and up-to-date information. And caregivers in some situations can also really help inform assessments and within the specialty areas or specialty services, and they can bring context to the situation of them caring with the care recipient or the care recipient's current situation, or if it's changed. So as you can see, there's a number of areas that family caregivers are providing support. The day-to-day activities of daily living, monitoring health. They're often providing emotional and cognitive support, managing medications. If they're attached to home and community care or community health services or other outreach programs, they're often helping to coordinate that, often managing care transitions, financial and legal aspects, transportation, as well as other areas such as end of life or palliative. Whoops. So when we talk to family caregivers as partners in care and we ask them what they want, there's 4 key areas. One is to be recognized. The second is to be informed. The third is to be included. And the fourth is to be empowered. So caregivers want their role and contributions recognized. They they're actually looking to be simply acknowledged as well as asked how they are doing. In some countries, caregivers are treated as their own client of the healthcare system. And we're not quite there yet in BC, but we're very hopeful that one day we will be. And so they really want to have that recognition that they themselves are an individual in addition to a caregiver, and they have their own separate needs from that of the person that they're caring for. So recognition is really important. In a recent study, only 25% of caregivers who interacted with a healthcare provider had been asked about themselves. And so that's only a quarter of family caregivers. We would love to see that percentage increasing by simply connecting, asking how they're doing, how can they be supported. The second area is to be informed. And this is really around understanding information around the individual that they are supporting and caring within the realms of privacy and consent. If there are some challenges around privacy and consent, working with that caregiver to help them understand how to follow the proper processes or how to be able to gain consent with the care recipient, and encouraging also the care recipient in some cases to include that family caregiver as their care partner. So the third one is inclusion, and this relates back to the idea that family caregivers are often doing different parts of care coordination and management. So understanding, having them included in the care planning and understanding the living environment or the family dynamics or who's available on the care team or their circle of support can really lend valuable information, as well as set out a very realistic, whether it's return to home or increasing services or accessing different types of services, can really help ensure that the care planning is appropriate to the situation for both the caregiver and the care recipient. And finally, the last area is to be empowered. And often what caregivers will tell us is that they often they don't know what they don't know. And so to have information, to understand where the care recipient is at, in a particular disease progression, to know what exists in the community, to know how to access that, to know the limitations of what can be provided through one service. That's a really important area for family caregivers to feel that they then can continue to care or have more confidence in their ability to care. So it's often around the right skills, the right information, knowing what's out there or how to access it. And that's something that not just healthcare providers can provide, but generally our social sectors and organizations like ourselves and other nonprofit organizations can really help family caregivers feel empowered in being a partner in care. So this is a particular case study. Essentially, Michelle is caring for Jeff, and Jeff suffered a brain injury 3 years ago. The accident left him with some cognitive challenges and some physical challenges. And Michelle really wants to be able to support him in his recovery and his independence, as well as being part of his care team. And so Michelle was helping Jeff, with transportation, coordinating his care, as well as being his wife and emotional support. And she herself, as a caregiver, was quite surprised that doctors and other service providers couldn't share information about Jeff, and so for privacy reasons. And so this is often something that comes up for family caregivers, that they just aren't even aware of some of the privacy and the legislation around that. So she was often feeling very frustrated because she couldn't
text Christina to text Mrs. Hermanson to find out if Joanne is.
Could everyone mute their microphones, please?
She doesn't want to go.
Or can you do that, Victoria? That would be great, thank you. Michelle was very frustrated because she couldn't access information and she needed to support her husband. And so it was affecting her way and how she interacted with the healthcare team, as well as being a caregiver to her partner. So this jumps us into what complicates caregiver inclusion in care. Well, the first one is generally it can be patient privacy and consent. What the research also shows is that our system is very well intentioned, but it's complicated. We have interacted with healthcare professionals who've often said, it's so complicated that sometimes I don't know how to navigate it. And of course, like any system, it has its gaps. And so understanding that even as a family caregiver is helpful in terms of knowing what to expect, or that there are going to be some ebbs and flows through system navigation. Often caregivers, and this depends on where they're at along the trajectory of care, that they're often quite bewildered by these systems, and they're also a little uncertain about how to speak up. And we mentioned this earlier, that our healthcare system, it wasn't designed to include family caregivers in patients' care. And so we're shifting into, I mean, we've been shifting for quite a while, but we're continuing to progress along, patient and family-centered care. And with that, it's going to take time, and it's going to, take different strategies at different parts within the healthcare system. So that's really what complicates caregiver inclusion in care. What's really apologies. Oops, there's some type of missing slide here. On the left-hand side, it's really what we're trying to say is that everyone really wants the same outcome, and that is the best quality of life and care for the person being cared for. And so family or healthcare providers, when we spoke to healthcare providers, and in the research, what they show is that they actually really want family caregivers to be part of care planning. It's sometimes there's limitations on how that can be achieved, and privacy and consent is one of them. That healthcare providers want families to understand that they actually recognize their rights and that they really care too, and that they're often balancing the individual, the client or the patient, as well as trying to factor in the consideration of the caregivers and how best to support them through a transition or through a diagnosis or through a treatment. And so family caregivers want healthcare professionals or staff to know that they really want their input to be heard and to be respected, and that they are experiencing a wide variety of different feelings. And this is something we often hear about on the caregiver support line quite a bit, is managing the range of emotions and the grief and loss that can come with caregiving, and the grief and loss of a relationship, or of a whether it's a spouse or a sibling or an aging parent, and that really to realize that they want what's best for their family member and friend too. And so it's this idea of how do we collectively work together in order to provide the best quality of life and the best quality of the care of the care recipient. So family caregivers as partners in care. So what, as healthcare professionals, we have sort of four areas or four strategies that we can focus on. One of them is help caregivers identify their needs. The second one is understand limits. Third is explain privacy and getting consent. And 4 is support and refer. So one of the greatest challenges that I think most of us might bump against is that often family caregivers may not even recognize that they're a family caregiver or that they need help. And they may, even when we ask them how they're doing, their general response will be, I'm fine, I'm fine. And so helping caregivers identify as a family caregiver is a really critical first step. The second one is around identifying needs. And this is, well, caregivers often don't know what they need. And it often depends at, again, where they are along the caregiver trajectory. And so looking at the needs for caregiving, what they need around empowerment, but also for their own well-being. We have a saying, I'm sure it's not ours, we don't own it, but if you've met one caregiver, you've met one caregiver. And so every caregiver obviously has different needs, different areas where they require support, different dynamics. And so really understanding as much of the nuances will really help be able to ensure that when care planning does, or if it's a hospital discharge or if there's trying to access community support services, that it really helps know what the needs of the caregivers are and what they're able to do in order to continue caregiving. Caregivers often need support or an ear to help them identify and prioritize their needs as well. And so that's often an area that Family Caregivers of BC supports caregivers with, is to help them prioritize and help them understand, okay, what are my needs? So the second area is know your limits and know limits and voice them. And so this is encouraging family caregivers to be realistic about what can be provided through formal services. We recently did some surveys with family caregivers and healthcare professionals, and this was an area that came up that family caregivers expressed that it wasn't always clear for a variety of reasons, the bookend of what formal services could provide, and also perhaps around them not necessarily knowing what was going to be needed, and so entered into situations where they didn't feel like they had the capacity to fill in other gaps. So encouraging caregivers to really understand their limits for themselves and to the person they're caring for, again, is a really important conversation. We see this with other.
Do we need to let Christina know she's not going to be there? I just did. Okay.
We see this with some caregivers where over time the care needs are increasing or the situation is increasing, and they're just not able to provide the additional care. And so understanding where their limits are or when it's time to make more difficult decisions around transitions is another area that we can support family caregivers. I think also it's just, caregiving is very dynamic and there's going to be changes in their limits and boundaries. And so, coming back to Michelle and Jeff, for example, when Michelle was, identifying her caregiver, or her needs, she really understood that she really struggled with how does she support her husband to be as independent as possible within his capacity, and how does she keep her own self afloat and not lose her own self-identity as a caregiver. And so exploring some of those limits with her over time, she recognized that, she couldn't do it all on her own. And they looked at ways to increase their circle of support and, engaged in working towards accepting certain services that, Jeff was hesitant about, but over time, was able to, realize the benefit for her in addition to him.
I'll get to it in a minute here.
So understanding and getting consent, this is an area that comes up quite frequently in our caregiver coaching sessions as well as on our caregiver support line. And one thing that Ontario is doing quite well right now is explaining the two acts of privacy and healthcare consent. And so that's one area that we can really provide support to care recipients and to the people we're caring for, is this idea of how do we support caregivers when the care recipient or the patient doesn't. So there are ways that we can engage with caregivers around encouraging them to follow different processes, encouraging the care recipient to include the family caregiver, and trying to work, if capacity is an issue, then also supporting the caregiver on how on the steps to follow in terms of being able to being able to overcome some of those privacy and consent challenges. So this is, yeah, I think that also the last piece is just appreciating that and expressing to caregivers that there's not one way to get blanket consent. Sometimes caregivers are not aware that they think if they give consent in one area, or if they get consent in one area, that it's blanket across the board. And so being clear about the systems they need to follow is very, is very helpful. So the last area is around support and referring. So healthcare providers can refer family caregivers to a wide variety of different organizations, but Family Caregivers of BC is one of the provincial programs that can really provide that direct follow-up support required for that caregiver. And so with caregiver consent, so if interacting with a caregiver, a direct referral allows us to initiate contact. This form is really easy to fill in, it's fast, it can be submitted through our website or downloaded or faxed. You can actually find a form on our website, it's under our Get Help section, or refer a caregiver, or under our education resources for healthcare providers. So one of the things as an organization that we're understanding and working towards change is just our hope is that caregivers will be formally acknowledged as their own entity, as their own client, so to speak, and as this critical component of our healthcare system. That we're striving towards working on policies to help support their identification. And there's some different programs that are happening in Canada right now that are working towards that, and those are caregiver identification badges, and in hospital settings, and so trying to look at some of those best practices and how do we bring those to all across Canada. We're still working towards this idea that family caregivers need to be included as partners in care, and that they need to be provided the supports and tools to help them continue to care. They really are, part of that frontline, frontline force that we depend on. Our community support are essentials for both within the health and social sectors, and that funding really is needed to support these programs, and that's a big area of what Family Caregivers of BC is also trying to accomplish, in addition to providing a direct one-to-one support for family caregivers and education and engaging with the healthcare system. So these are some of our own goals that we're continuing to strive towards, and with the hopes that we're going to be able to make some change in the future. So that brings us to the end of our presentation. Thank you again for joining us. We have a lot more resources on our website. We have a dedicated page for healthcare providers that we're starting to curate with more information. We'd love some feedback around what would be helpful to you as healthcare providers, and we're happy to open up the floor for some questions. Do we have anything in the chat box?
So far, I'm not seeing anything yet, Wendy. Hopefully we answered everybody's questions and they have nothing that they're curious about, although I'd really love to hear some comments, feedback. If you ever do get a chance to look at our website, I know you all have busy days. We would love feedback on resources, any areas we can improve.
You can reach out to us by email as well. A recording of this will be available on the website, so you're welcome to take a look and click on some of the links as well in terms of referral to Family Caregivers of BC. But I'm sure all of us are eager to get started on our days as well. So thank you again for your time. Please reach out to us with any other questions and comments, and we'd be happy to answer them.
Okay. think we'll let folks go. Hey, Wendy.
Sounds good.
All right. Thanks for participating, everyone. If you do have questions, please reach out. We're always here to help.
Thank you. Bye-bye.